They refused to provide treatment without a Russian passport.
It was one of the key tools used to manipulate people into forced passportization.
They concealed a severe shortage of medical staff and medication.
You get the impression that the level of healthcare there has been set back 30 to 40 years.
Killing civilians through cruelty and indifference.
There was a shelling in Oleshki. An ambulance arrived. A small boy, his entire body riddled with shrapnel, bleeding out. They said, "We will not treat Ukrainian children."
Russia has created a genuine humanitarian catastrophe in the temporarily occupied cities and villages of Ukraine, turning medicine into a tool of control and coercion. The full truth in detail in this special report, Medicine of Death: How Russia is Destroying Healthcare in the Occupied Territories. Russia's full-scale invasion has resulted in the damage or complete destruction of over 2,500 medical facilities in Ukraine, targeting hospitals, maternity wards, and outpatient clinics that provided essential health care. The true scale of destruction in the occupied territories remains unknown, but one thing is clear: Putin's aggression is not aimed solely at the opposing military. In violation of international law and the established customs of war, Russia wages war against civilians. Under its strikes, not merely buildings, but the very right of people to life and medical care. Footage of the bombed maternity hospital in Mariupol went around the world. March 2022, one of the first Russian strikes against a Ukrainian medical facility.
Авиация сработала по роддому. Вот вам россияне.
The Russians dropped an aerial bomb deliberately on a building sheltering hundreds of mothers and their children. The hospital was completely destroyed. 6 people were killed, among them an infant. Andriy Marusev witnessed the aftermath of that strike with his own eyes. He had lived in Mariupol his entire life, and the full-scale invasion found him at home. He recalls, "The Russians destroyed every hospital in the city."
I have nothing but the deepest respect for the doctors. They were true heroes, selflessly trying to save lives. With no electricity, the generators failed very quickly. Medications ran out fast.
But the full number of hospitals destroyed across Russian-occupied territory is almost impossible to imagine. Some cities have simply been wiped from the map. And what bombs failed to destroy, the occupiers are dismantling through legislation. Medical facilities are being shut down under the guise of reorganization. Those still operating are fighting for survival.
What we are seeing is a complete degradation of the healthcare system at its most basic level. When a person urgently needs help, in 80% of cases, they will not receive it. The most a doctor can do in a recently occupied settlement is treat a wound with antiseptic. Hospitals are either destroyed or occupied by the military. There is no access to equipment, and sometimes there are simply no doctors at all.
Long lines, locked offices, and arguments with medical staff. This is footage from the central and only functioning hospital in occupied Mariupol. People are forced to fight for their right to receive care. The occupation authorities carried out a cosmetic renovation of the building's facade, but the interior infrastructure and conditions draw nothing but complaints from local residents.
The office is locked, there's a crowd of people waiting, and she's eating her lunch, even though there's no lunch break on her schedule. She won't let anyone in. The doctor is tired, apparently. People have been here since early morning.
It was in this very hospital that all Mariupol residents were being treated during the summer of 2022, when the city recorded its highest mortality rate, around 400 deaths per month.
The entire sewage system was destroyed. This is the summer of 2022. Crowds of people were drawing water from springs because all the heating infrastructure and water mains had been demolished. Mariupol remains to this day a high-risk zone for all manner of infectious disease, cholera, and everything that comes with it.
4 years into the occupation, Russia has still failed to restore order in the very hospitals it destroyed. Mortality in the city remains high, due in part to the chronic shortage of qualified doctors, equipment, and basic medication. A city that once performed complex surgeries that had modern technology and top-tier specialists has been pushed back decades. Today, says Andriy Marusov, falling ill in Mariupol is terrifying. A perfectly treatable condition can end in death. He knows this not from statistics, but from personal loss. His father's heart stopped because of medical incompetence.
They couldn't diagnose him for a long time. He was admitted to the 7th floor of the hospital. In Mariupol, that floor is still known as the death ward. First they said it was cancer, then pneumonia. They kept him there for 2 weeks. Gave him various medications, no one seemed to know what for. Then they discharged him, and a few weeks later he was gone.
The situation across occupied Donetsk region is equally dire. In Makiivka, the only primary care center cannot cope with the volume of patients. Waiting times to see a doctor stretch to several days. In Luhansk region, inpatient care is effectively being phased out. Due to a shortage of beds and staff, patients in acute condition are increasingly turned away. The same picture holds across occupied Zaporizhia and Kherson regions, where surgical and intensive care units have been shut down. In smaller towns and villages, hospitals are not functioning at all, and in some areas, the only medical point left is a paramedic station staffed by nurses. Children in the occupied territories are also suffering deeply.
Vision and dental health are areas of severe concern. There is simply no one qualified to provide proper consultation, to catch problems early, or to take preventive measures to protect children's eyesight and dental health. Those resources do not exist there.
We've never had any really serious emergencies with the child, just regular colds, fevers, sore throats. But getting hold of medicines is incredibly difficult. Sometimes I see a drug for the first time, and to be honest, I'm terrified to give it to my child. I'm afraid to take it myself, and giving it to the kid is even scarier.
Inna is from Kherson region. Her city was seized by the Russians in the early days of the full-scale invasion. She and her family, with a 1-year-old child, initially planned to leave, but they could not bring themselves to abandon her grandmother, who has limited mobility. The elderly woman has a heart condition, and getting the care she needs turned out to be impossible.
Without steady, regular treatment, the same one over time, her health just keeps deteriorating. She doesn't get any relief because the drugs are constantly different. We can't even do basic checks like a heart ultrasound or an ECG. We had to buy our own blood pressure device and are managing to monitor it ourselves as best we can.
The occupiers see no problems in the medical sector. Everything is resolved with paperwork and statistics. In Kherson region, the self-proclaimed authorities have registered 24 hospitals in their official records, including facilities in already deoccupied areas. According to Russian reports, 207 medical institutions are functioning in occupied Donbass. The occupiers say nothing about the quality of this so-called medicine. Instead, they loudly proclaim the arrival of reform. In August 2025, the so-called Ministry of Health of the DNR announced a reorganization of primary healthcare centers. In reality, under the cover of reform, these centers are simply being dissolved, absorbed into city and district hospitals. The move is presented as a measure to improve the quality and accessibility of medical services. And yet, even calling an ambulance has become nearly impossible.
There used to be around 50 vehicles. Now there are 16.
17.
17? That is nowhere near enough.
It's essentially nothing. Just imagine having to travel from here all the way to the left bank. My first call today was to Murny, near the women's prison. The roads are in that kind of shape. That's a minimum of 25 minutes of driving. Is that an ambulance service?
No, it's not. And what are they saying? Will they be adding more vehicles?
There is no medical personnel to staff them.
We know of a case where an elderly woman felt unwell and simply collapsed. The only thing she could do was call her daughter and tell her what had happened. The daughter called an ambulance, but it never came. Instead, the dispatcher began giving advice over the phone. They recommended she see a neurologist since the woman had lost feeling on the left side of her body. The next morning, they managed to call a private doctor on their own. But by the time he arrived, her mother was already gone.
One of the primary causes is a severe personnel crisis. Following the full-scale invasion, the majority of qualified doctors left the occupied territories, moving to safer regions of Ukraine or going abroad. In Donetsk, Luhansk, Kherson, and Zaporizhia regions, where thousands of medical professionals once worked, only a handful remain.
The Russians began offering good salaries and good conditions, but the salaries turned out to be the same, or in many cases, significantly lower. Meanwhile, the workload keeps growing. It becomes a vicious cycle. There are cases where a single doctor is expected to perform 100 different functions.
Ksenia is one of those who was forced to leave behind the work she loved at a local clinic and flee the Russian-occupied town of Primorsk. For refusing to cooperate with the occupiers, Ksenia found herself squarely in the enemy's crosshairs.
I am an active member of my community, and everyone knew it. I had always been a patriot, so staying was simply no longer an option. The persecution began, and by that point there were already abductions, doctors being taken, active community members being taken. It had become impossible. It was a danger to my life.
A critical shortage of personnel is recorded across all occupied territory. Specialist doctors especially scarce. The crowd in this footage is a queue to see a specialist. Patients line up from early morning, take numbered tickets in advance, and wait for hours. Getting an appointment with a specialist is considered a genuine stroke of luck, if, that is, you manage to endure the wait. Because more often than not, these doctors simply are not present in local hospitals. They come temporarily, or patients themselves must travel tens, sometimes hundreds, of kilometers just to receive a basic consultation.
If there is no specialist, you have two options. Either you die, or you pay out of pocket and get yourself wherever you can. Those who managed, those who could pay. Naturally, that means Simferopol, or Crimea in general, or Russia, Rostov, Taganrog, Krasnodar. That is a more serious undertaking, and only those with money can afford it.
The Occupation Administration attempts to partially fill the staffing gap by bringing in doctors from Russia. In 2024 alone, more than 400 medical workers were sent to Donbass, participants in the federal programs Zemsky Doctor and Zemsky Paramedic. They are promised housing and high salaries, but those willing to work in close proximity to an active combat zone have turned out to be far fewer than expected.
They promised their Russian medical workers signing bonuses ranging from 500,000 to 2 million rubles, depending on specialty, qualifications, and other criteria. Even that program failed to attract personnel. What arrived instead were, I don't know where exactly they came from, so-called doctors who treated people with oak bark, herbal decoctions, practically with prayer. And of course, locals were shocked. We had real, evidence-based medicine grounded in science. And then people showed up who seemed to have stepped in from a completely different era.
The visiting doctors, as a rule, work on a rotation basis. But even they cannot endure the conditions of occupation and frequently return home after a couple of months. As a result, in many hospitals, unspecialized medical workers are simultaneously performing the duties of surgeons, anesthesiologists, and pediatricians, which of course has a direct impact on the quality of care.
There's the case of a man from Berdansk district who developed an infectious bone disease, osteomyelitis, a chronic condition. And under occupation, doctors could not diagnose him. They kept telling him, wait a few days, it will resolve on its own somehow.
Due to the acute personnel shortage, people with questionable credentials are being hired en masse. Recently, Occupation Media aired a report about how graduates of fake medical institutions from the occupation authorities are being employed in Tokmak, in Zaporizhia region.
I help the head physician, Lyudmila Ivanovna, with reading scan results. We look at clinical cases together and write up the descriptions.
But there is more. In the autumn of 2025, Putin signed a law mandating a compulsory 3-year work placement for medical graduates. Newly qualified doctors are now being forcibly assigned to economically depressed and frontline regions, including the occupied territories of Ukraine. In Russian universities, this triggered a wave of protests and mass withdrawals. Students themselves describe the new law as the stripping of rights and forced labor for a pittance, and that is the most accurate description of the entire medical sector in the occupied territories. But receiving treatment there is even worse than providing it. All services are paid out of pocket, despite Russia's declared commitment to accessible healthcare. Diagnostic equipment operates only in major centers, and even then, it is outdated and poorly maintained. The modern equipment that stocked hospitals before the occupation has been stolen and removed.
Usually, they take everything out to the territory of the Russian Federation. This was especially true back in 2023 when Ukraine was preparing for the counteroffensive, and, for example, there was a real chance that Melitopol could be liberated. At that time, the Russians were removing anything of any value, including medical equipment.
Self-medicating in the occupied territories is no solution either. Supply chains for pharmaceuticals have been severed. Finding the necessary drugs on the shelves of local pharmacies is simply impossible. What is available are low-quality Russian substitutes.
It happens that you buy a medication, and there's just a week or a month left on the shelf life. You never know how your body will react to it because these drugs are unfamiliar to us. They're completely different ones.
Antibiotics, antihypertensive medications, dialysis supplies, and drugs for kidney failure are all in short supply. And insulin, which in Ukraine is dispensed free of charge, is being openly sold in the occupied territories. People with chronic conditions are being forced to abandon their treatment.
When it comes to specific conditions, oncology, diabetes, chronic illness, the situation is extremely difficult, especially for bedridden patients. One can say that such people are, tragically, condemned to die because no one is helping them. The only medications they can access are whatever they manage to obtain through whatever means they can devise themselves.
The situation with vaccines is catastrophic. Occupation authorities are prohibiting the write-off of spoiled medications. In Henichesk, doctors are being threatened that if they do, they will cover the cost out of their own salaries. This creates serious risks for vaccination of both children and adults. Even more dangerous, Russia is actively promoting its own uncertified vaccines, not recognized by a single credible international organization.
Temporarily occupied territories are indeed frequently used by Russia for testing various substances, including vaccines. Essentially, there is no access for human rights organizations there, and no legal framework exists. Taking advantage of this, they openly conduct experiments on people.
But even the meager medical care that still exists cannot be accessed without a Russian passport. Russia has effectively turned medicine into a tool of coercion, forcing people to obtain Russian citizenship just to have any right to treatment.
We have a documented case where a man was denied assistance and was told directly, "No passport? Go ahead and die." He had become disabled, his wife was caring for him, and no one was willing to help them without a passport. The woman managed on her own to get him out to Russian-controlled territory. And there, because they held Ukrainian passports, they were again refused treatment. The man later died.
There was a case where a woman came to a maternity ward to give birth and was denied entry because she had no Russian passport. It was fortunate in a way that it was a planned cesarean rather than an emergency, and that there was some time to wait. But even then, every hour counts. Both the mother's life and the child's life depend on it.
Quality medical care in the occupied territories is available exclusively to Russian military personnel. Hospitals are being converted into field hospitals. Civilian patients are simply not admitted. Medications, equipment, operating rooms. Everything functions solely in service of the military.
At one point, footage even surfaced showing occupiers filming inside the central clinic in Berdyansk. Patients lying everywhere, in the wards, in the corridors, dozens of them. While they are being housed there, it goes without saying that no civilian can receive treatment, no civilian can access medical services.
In the occupied territories, the very concept of healthcare as a human right has been completely dismantled. People there are not dying because their conditions cannot be treated. They are dying because Russia has deliberately made medicine itself impossible. And this destruction began as far back as 2014 in the seized lands of Donetsk, Luhansk, and Crimea. Drug supplies were cut off, vaccines and equipment halted, funding stopped. Patient and doctor databases were wiped entirely. And from 2015 onward, Russia began integrating these territories into its own healthcare system imposing Russian treatment protocols, but without training doctors or supplying the necessary medications.
People living in temporarily occupied Crimea speak extremely poorly of the healthcare there. Denials of service are common, and there is quite literally a simple absence of medication. Funds are supposedly allocated for it, but the drugs never arrive.
All of this was accompanied by loud promises to modernize hospitals, upgrade equipment, develop healthcare. In practice, hospitals that have not been shut down continue to operate in a state of disrepair without renovation, equipment, or specialists.
Overall, despite the fact that funding nominally continued to increase over the years, due to the fundamental dysfunction of Russia's own healthcare system, its corruption and extreme bureaucratization, that supposed increase in funding almost never in practice, virtually never reached the end recipient.
Over 12 years of occupying parts of Ukrainian territory, Russia has failed to create any viable conditions for healthcare development, and it is unlikely to do so in the newly seized lands because developing these regions holds no interest for the occupiers. Medicine here has become a tool of pressure and control. Such actions, experts assert, constitute a direct violation of international humanitarian law.
They are in violation of the Fourth Geneva Convention on the Protection of Civilians in Time of War. Article 56 governs the provision of medical services, that is, ensuring the welfare of the population in occupied territories.
Russia is a signatory to the Geneva Conventions. That has not stopped it from violating them systematically, and it is precisely these actions that may form the basis of future legal claims against the occupying state in international courts. Russia is not waging war with weapons alone. It is destroying the very right of people to live. In the occupied territories, medicine has become a tool of control, and hospitals have been reduced to ruins. Moscow has made abundantly clear that it is interested in plunder, not development. It has no use for these people. Both in the Kremlin and on the ground, the preference is to loot whatever funds exist, including those designated for healthcare, condemning the civilian population to suffering and death from preventable disease. Yet one more crime for which Putin and his accomplices will have to answer. Sofia Kutsenko, Special Report.